And there's just so much that can be done with technology to help deliver better care. There's such an acute shortage of staff. And I don't think it was because the places had bad intent. It's just they didn't have enough staff. They need help, and technology can help.
If you had to manage 27 different technologies on your community floor today, how could your team even figure out who to call when something breaks? Today's guest says it doesn't have to be that complicated, and AI might be the key to making care more human.
Welcome to From Leads to Leases, a CCR growth podcast that helps senior living providers transform their complex challenges into opportunities. Listen in for stories from industry leaders, innovative strategies, and insights. And with our expertise, learn how to increase occupancy faster, guaranteed.
Welcome back to another episode of From Leads to Leases, the podcast that dives deep into the senior living and senior care industries, bringing you insights, strategies, and stories from the experts at the forefront of innovation, leadership, and care. I'm your host, Jerry Vinci, CEO of CCR Growth. For those of you who don't know about us, CCR Growth is a full-service marketing and growth agency that's exclusive to the senior living industry. And through this podcast, I'm here to guide you through the evolving landscape of senior care, exploring the innovations and leadership insights that are shaping the future of the industry. So whether you're a provider, caregiver, or industry leader, this show is here to help you make informed decisions and create meaningful impact. All right, today's guest is Ernie Ianace, the CEO and founder of CareAlly, a healthcare and senior living technology company that uses AI to simplify operations, empower care teams, and help communities unlock better outcomes. A serial entrepreneur with 5 successful exits under his belt, Ernie has spent his career building platforms that solve complex problems at scale. CareAlly is his most personal venture yet, fueled by the caregiving challenges he experienced in his own family and shaped by a belief that the right technology should give caregivers back what matters most, time. So Ernie, welcome to the show. I'm so glad to have you here.
Jerry, thanks for having me. I'm excited to be here.
Yeah, absolutely. Absolutely. So I think first, let's just talk about CareAlly. Let's explain to our audience what it does and what problem you're solving.
Yeah, and maybe a tiny bit of history to sort of tell you how I got here, right? So
Sure.
we built a virtual care platform called VitalTech and treated hundreds of thousands of seniors, both in post-acute and long-term care through COVID right up until this year, right? And we sold that. But while we were doing that, through multiple chronic conditions and different environments, both in Medicaid and Medicare, FQHC, senior living, all different environments. We saw a lot of things, right? A lot of things that worked, a lot of things that were broken. And, one of the things where caregivers just do not have enough time. They're overwhelmed with paperwork and with administrative functionality. They just don't have a good flow of information across the care continuum. And we were able to add some of that to our platform at VitalTech before we sold it. But it was also 7-year-old technology. So we're like, gosh, if we could do it all over again. And now in the new emerging world of AI first, what would we do different? From the ground
Sure.
up, we build it with AI, right? And APIs and open and all that. So we set out to build that. And it needed to do a bunch of things. One, it had to be completely open. It had to talk to absolutely everything. It had to be able to use natural language to build any workflow that the care provider needed, whether it be an administrative workflow to solve a problem with like, hey, you know what, I need a schedule change over here because I just found out my kid's sick and I need off next Tuesday, and route that through the whole system, right? Let my coworkers know so someone can pick up a shift, let my boss know so they can approve it, and then write it back to the scheduling software so that it's there, right? And that needs to be flawless. And oh, by the way, you can't write code to do that. You just have to tell the system, build this workflow, and it goes and builds it. To fix my billing problems, to orchestrate a care pathway, and make it a clinical workflow. So we went out and built an AI orchestration platform that could do just that. And it's built, it's live, it's deployed, it's starting to get traction, and it's really designed to be able to do all of that. Because what we heard over and over again from whether it was a big CCRC or senior living operator or a very, very large health system, they don't want point solutions. They're buried and drowning in point solutions. They want a platform that they can build on top of. They don't necessarily want to try to boil the ocean. They might want one thing right now, but they certainly don't want one more point solution. So that was kind of the genesis of CareAlly, is we wanted to build the next thing that would solve all the problems we experienced as we were building up Vital Tech. And I think we have done a pretty good job, and really was listening to the clinicians, listening to the people on the ground and saying, okay, what do you still need and what's still very broken? And just watching our customers and us struggle with, God, if we could only do this. So we went and did it.
I think that's really interesting too. This industry has so much antiquated software and hardware, and most of the time it's obviously for budgetary concerns, but also because this industry is not on the cutting edge when it comes to tech most of the time. They're not early adopters. So you see a lot of those legacy platforms that can't be retrofitted. And now that you're coming out with something that's completely open, like you said, and AI driven, I mean, that completely changes the landscape. So what were some of those key lessons that shaped how you built CareAlly from the ground up?
Again, one of it was natural language, right? Like,
Yeah.
again, because there is not a ton of tech resources available inside of a senior living operator, you can't ask their IT team to do a lot, right? They're overworked to begin with, they're understaffed. So you don't want them to have to do any heavy lifting. You want to just be able to walk in and plug in. So that was a really, really big one. And if you want someone to be able to build a workflow, let's say it's an HR workflow, for example, right? Be able to change a schedule. They got to be able to articulate what they want, maybe on a Word doc or on an Excel spreadsheet, and hit go, and it loads it into our system. And IT never saw it, never touched it, never cared, right? Because if you need IT to go build something, my gosh, you could be like 33rd on the list and they don't have time or bandwidth to get there. And no knock on them, by the way. It's just there's too much for them to do with limited resources. And they're already dealing with really difficult, antiquated systems that they're trying to get reports out of and data out of for their clinical or their operation and their finance teams to do their job on systems that were never really designed to give them what they wanted, right? And it's almost like some of those older systems were almost built with moats around them so that they don't give you the information easily that you need. So, again, I don't want to put a knock on any of the incumbents, but some of the incumbents have made it really hard to get information out of them, and they're not working really, really aggressively to open up, right? Unless I think the government forces them open, I think they're going to stay as closed as they can, as long as they can, simply because it makes it hard to displace any of them.
An interesting data point I was reading from Argentum, they said that the senior living industry is going to need at least 1.2 million new workers by 2040. But turnovers, I think it's over 50% in most markets. So one of the things that you had talked about last time was labor costs and the conversation around time. So what happens when frontline workers have access to real-time answers in natural language? How does that shift the landscape?
What we're seeing is our system, when it's implemented, even in its most basic form, we have a module in HR, kind of retention module. It helps with onboarding, it helps with training, and it helps with retention. And it really does a good job of all three of those things. Yeah, it can get someone onboarded quicker, and get them trained quicker, but that retention piece is really, really important. And let me tell you a couple of reasons how retaining happens, right? One is it gets rid of some of the noise and some of the repetitive tasks you don't need to do. Let's say you've got an employee in the middle of the night that they're doing hourly room checks because you just don't know what's going on inside that room. So you have no choice. But if you can start looking inside the room and saying, you know what, 99% of your residents in your memory care unit, they're asleep. They're peaceful. Everything's good. Don't bother, right? But Mrs. Smith in room 102 just got out of bed. She's a high fall risk. Go help her. And you help her. And all of a sudden, in the first 30 days, you start seeing your falls drop dramatically. The employees you want, you just gave them more meaning in their job. You just gave them a much higher impact on what they're doing and got rid of a lot of repetitive kind of almost worthless tasks, I would say. They're not worthless before you have the technology because you needed to do it, right? But if you give them technology where you can get rid of those repetitive tasks and give them a higher value task. Gosh, I just stopped someone that fell 3 times last month from falling at all this month. The people you want to keep, the people that care, that got into this industry because they want to deliver care, they stay because you give them more meaning. And that really, really matters. So you're retaining not only more, you're retaining the right people. So I think that's really, really powerful by giving context and meaning to their job and giving them the information they need at the right time to make a difference.
And not just retention, but I think just the staff being overwhelmed. How are you seeing communities use CareAlly?
That's another really, really big one, right? Just being able to, I tell this story all the time, right? Like you've got a staff member and I talk to communities sometimes that they can't even get CNAs, right? Like they're pulling people up. Again, I might be being a little bit facetious, but they were at McDonald's last week, and now they're on the floor this week of a community, right? And all of a sudden, it's 2 a.m. and they're in someone's room and they're on the floor that they've fallen and they're bleeding and they're in panic mode because they don't remember anything what to do. But they can ask CareAlly, "Hey, what do I do?" And not only will it tell them exactly what that operator wants them to do, but also all the rules and regulations in that particular jurisdiction. Because let me tell you, California is a bit different than New York. It's a bit different than Texas. It's a bit different than Virginia, right? So, because again, the operator doesn't want them just dialing 911 by reflex, right? If they don't need to send the resident to the hospital, no one wants the resident going to the hospital, including the resident. You run the risk of infection, you run all kinds of problems could happen, right? So it's really about just empowering your employee to have the right information at their fingertips in whatever language, by the way, they may speak. Because let me tell you, that employee that just started, they may not even have English as their first language, right? I mean, if you'd be talking about maybe a river spring in the Bronx and they could be speaking Ukrainian for that matter as their native language. They might have been in a panic mode because they're seeing someone on the floor in pain and they ask the question in Ukrainian, not even realizing they didn't speak English. The system's going to answer them in Ukrainian, right? Or you could have someone in South Florida asking in Spanish and it's going to answer them in Spanish. It's really, really important because it filters out all the noise and gives them the relevant factual information when they need it, where they need it, and gets rid of all of the noise. And I think that's just critically important when they're doing their job. Something is as high stakes as that to something as, you're just walking around the hallways and saying, "Hey, what's my schedule on Tuesday? Something just came up and I don't remember what I'm working," right? And I've got a personal thing with my kids. Do I need to worry about a schedule change? So those types of things, across the spectrum of from personal to delivering care, all that is inside of our system. And, and I'm going to give you another example. We're doing this project that's about to go live at Moorings Park. We took 27 different manuals from they're implementing a very, very new, super high tech building, where they've got 27 different tech systems going in, everybody from Nobi to, gosh, across the spectrum. Rhythmos is all going in there. And they're like, how do we get all these guides into one system so that when the staff's walking the floor and they have a question, they don't have to go look up a manual of 35 pages from Nobi and figure out, how do I do X? How do I change the batteries on my Rhythmos? All they do now is ask CareAlly, how do I do X? And it tells them. And that's super, super powerful because they don't have to go figure out, where's the manual for Nobi? Where's the manual for Rhythmos? Where's the manual for Safely You or whatever? It just answers their question and however they want to ask it in whatever setting they're in. And again, it's things like that that just save them time, frustration, and money.
Would you say that's the biggest platform problem that's out there right now and why point solutions are kind of failing operators? Because they do have all of these different touch points?
I think so. And don't get me wrong, you can't get rid of the point solutions in a lot of aspects because they're just some of the best point solutions are needed because they're the best at what they do, but you have to integrate them. And, it's really hard. There's not a lot of ways to integrate them seamlessly. Sarah Thomas has been driving that project at Moorings Park, and she's brilliant. And she's been the one driving that integration, right? But if you don't have a Sarah Thomas, and the resources of Moorings Park, knitting all that together, my gosh, I feel terrible for you, right? And that's kind of why we built CareAlly, is to solve that for you. We can fix that for them, right? By just plugging it all in and it does it for you. But my gosh, I mean, but even Sarah said, Ernie, can you help us by at least distilling all the knowledge of these 27 systems and giving an assistant to the staff so that they can ask it questions when I walk away and they're doing their job and they need help, right? But it's, she picked great systems for each of their respective, like the best thing for monitoring vitals and falls, the best thing for this. So you need point solutions still, unfortunately, right? But you need a platform to pull the point solutions together, I think. And slowly, I think you'll be able to do more and more things on platforms. But there'll be certain things that the point solutions will never go away, right? I don't think you're ever going to say a platform is going to be the best at fall prevention and detection, right? Or, RTLS or, wander management or things like that. I don't know if I'd want to trust a platform vendor to be the best at those, because certain things that are just so mission critical, you want the best of the best for that, which is again why you want an open platform that you can take out 3 years from now when the
Sure.
next best thing comes out. You want to unhook and rehook, and it needs to really be a day or two, not 6 months.
And if someone doesn't have a Sarah Thomas, what's the first step an operator should take when evaluating an AI-enabled platform?
I really think you need to know that it's 100% open.
Mm-hmm.
It doesn't hallucinate ever, because it doesn't actually go to the LLMs for information. It only looks inside your walled garden and what it's fed. And just really, how user friendly is it? Or, is it easy to just build your workflows, right? Can you just talk to it, tell it, I need you to go do X, and it goes and builds the workflow to go do X. There's not a ton of AI platforms in senior living. There's a few, and we're actually partnering with most of them. That's a nice thing about the senior living economy. We compete and we collaborate all at the same time. CareAlly, who's at Morning Spark, actually, David Moss and I have agreed. You know what? We could probably step on each other a little bit, but you do really cool stuff over here, David, and I do all this stuff over here. So instead of competing, why don't we just collaborate? Between the two of us, we can do everything.
Love that.
And I think that's more powerful, because our job is to solve the problems of the operator and to take better care of seniors, right? None of us, I think, are truly in this for the money anymore, right? I think we've all been, the ones that are still here, most of us have been successful enough. It's a mission at this point, right? At least I know it is for me, and I know it is for
sure.
David.
Yeah.
So we're just like, you know what? If we collaborate, we can solve everything. So let's just not even try to compete. Let's just hook together and let's just go solve this, right? So, I just think that, again, if you don't have a Sarah Thomas, but I would recommend getting a Sarah Thomas or Jill Sumner, who's another, phenomenal resource, independent consultant, or Janet Tameyer, right? They're all sort of out there. Janet was, I think, VP of nursing for Charter. Jill, just total expert in the space. But the point is that you really just need something that's massively open and can connect to everything, and really, really user friendly. And I think that the executive team is willing to collaborate with everybody else, because that's the other thing. There's players out there that are not bad, but they're not terribly willing to collaborate. And I think that in itself is bad, because that locks you into them. And if they're not willing to entertain the next really cool new thing that you might want 2 years from now, why would you want that platform?
Yeah. Yeah. That's a great question. I mean, they're fighting for their own survival. They're not concerned about what's best for the community or the operator.
Exactly.
Yeah. Talking about AI a little deeper too, there was a study early 2025 that said ChatGPT had an average hallucination rate of 15 to 30%, which I think is probably pretty low, depending on the complexity of what was being asked of it. How do you prevent hallucinations and ensure trustworthy outputs in a healthcare setting? I got to think that the stakes are a lot higher in this industry.
Yes. Yeah. And unfortunately, that number is low. It's gotten worse, not better. It's now above 30% hallucinations. We don't ask ChatGPT any healthcare questions. Our AI platform is trained only on the data that we give it. So basically, we'll pull it out of your EMR, we'll pull it out of your claims data, we'll pull it out of your policies and procedures, out of state regs and policies, out of federal stuff, and say, here is your universe of stuff you're allowed to answer questions about. This is it. You may not go to the LLMs for the answer because they're going to lie convincingly 30%, 33% of the time. And in the complex question, 35% of the time, right? And they're going to do it with a smile and convince you they're right. But unfortunately, they just hallucinate and it's not getting better. So
Scary.
you really have to make sure that you put really serious guardrails around anything you're deploying in healthcare. And we just simply do not let our AI go outside the walled garden of the enterprise, senior living, or the healthcare systems data set. Now, you can go to the LLMs and say, listen, I've got a question that's been asked in Albanian and I need you to translate. But even that we don't trust because something that simple, they'll still hallucinate 5-6% of the time. So we'll ask every LLM at the same time and we'll ask them 4 times each and get 20 answers back. And then we have an agent that'll grade that. So it'll be 18 agreed. So that's the right answer. Those 2, throw them out because they were slightly wrong. So the accent's probably wrong. So that's the only time we're going to do it is if we can highly parallelize it and give them the answer out of the data set and say, okay, here's the answer. It's exactly this. Don't change anything. We just really want you to translate it to this language, but we're still not going to really trust you. We're going to ask you and all your peers a lot of times. And if a whole lot of you agree, then we'll trust that.
That's pretty solid. That's a solid approach. So, I mean, have you seen pushback from operators at all because it's built using AI?
A little bit until they test it. And when we put their data sets in there and they ask it 100 questions and it comes back 100 times perfect, then they get very excited and they ask, and they send, can you add these 100 more documents and plug it into our EMR? And, can you look at our claims data? And so it usually goes away really fast when they start, really pounding on it. And it just doesn't, because it'll tell you if it doesn't know the answer. That's the other thing. It can customize how it tells you no, right? But it'll say, hey, listen, that's out of my scope, or I wasn't trained on that data, or that's not something I'm allowed to answer, or something like that, right? Like, how do you treat complex cardiomyopathy or something? If we didn't say it's allowed to answer that, it just won't answer that, right? If we gave it the answer, because the cardiology department out of Emory says, here's the answer set, give it to that, let it answer, it'll answer that. But if we say you're not allowed, if you don't have that answer, this is how you answer a question that you're not fed the data, it'll simply say, can't do it. But again, you can customize by user persona how it nicely tells you I don't have that answer.
Talking about value-based care too, I know this is something that you're pretty passionate about. I was doing a little bit of research on this, and most senior living communities aren't ready or haven't implemented value-based care. I think the data set said something like less than 20% of providers are actually participating in value-based care. So how can AI help bridge that gap?
So I think, and I'm pretty passionate about this, there's this monster wave of seniors that are crashing into our industry. It's happening later than I think a lot of our industry thinks, right? Because they're going to show up older with higher acuity.
Yeah.
Everybody thinks, the silver tsunami, so to speak, it's happening in 27, 28. I maintain it's probably 2030 on, because they're going to show up in their 80s and they're going to be sicker. But the issue is, if you're building at the very, very high end, they can certainly afford it. And at the very, very low end, it'll be subsidized by Medicaid. But in the middle, which is the biggest, how the heck do you pay for that, right? You can't charge enough to provide the care they're going to need privately. And right now, we have no public mechanisms how to pay for that unless they spend off all their assets and then they're dropping into the Medicaid bucket. Value-based care, in my opinion, is the only way to get there from here, right? But right now, most of that money lives in the ACO world and in the hospital systems and stuff. And it's the wrong place, right? They don't see the patient between visits. They can't affect social determinants. They don't know how the senior lives or eats or do any of that kind of stuff. Once they live inside our communities, we know, right? We see them every day. We know how they're eating. We know if they're depressed. We know how they're interacting. We can actually move the needle at the most expensive time. So senior living communities need to participate and get a chunk of that money. Now, if you're a member of an iSNP or a DSNP, you're already starting. But you're right, it's a small percentage.
Mhm.
Here's the problem. To get part of that money, you have to take risk. And most communities aren't ready for that risk, because if you miss, you also experience the downside, right? So platforms like ours and AI can get them ready by start collecting the data, understanding how you affect outcomes, and then once you're ready, know, okay, I can avoid falls, I can avoid hospitalizations, I can avoid emergency room visits by X on my population. I can start moving towards the value-based world. And you don't have to dive off the deep end. You don't have to say, I'll sign up for a 100% risk contract, right? You can take a 25% risk or a 50% risk and then move to the 100% risk. There's ways to do it. I helped a company called Amba. My wife still is in charge of their marketing, and they actually have all these passive sensors, and they put them into senior living operators, and they use the RPM CPT codes, and they bring in a clinical overlay team to help bill. And they actually, it's completely free to the operator, because the CPT codes pay for the equipment and the clinical oversight team. And it also gives the operator all kinds of insight into what's going on overnight on their population. So it drives dramatically better care. You get clinical oversight, and you get all this data that says, oh my gosh, we're changing all these outcomes, and the outcomes are extraordinary. Well, our platform does the same thing across lots and lots of different modalities. And if you do that for a couple of years, one, you're going to have dramatically better outcomes. Your occupancies are going to get dramatically better. You're going to see psychotropic drug use drop. You're going to see hospitalizations drop. You're going to see falls drop, all kinds of stuff. And then after a couple of years, you say, I can take some risk, because you know what? I know what my outcomes are. And now all of a sudden, value-based care is a lot safer, and you can start going after the bigger piles of money that you frankly are going to have to take care of those higher acuity seniors. But they got to start, because that wall of higher acuity seniors is going to come crashing into our industry over the next 5 to 7 years. I think we've got a little more time. The operators that just think it's, next year, again, I think they figured out that seniors are waiting a lot longer and they're showing up a lot sicker. But some of them, I still think that they're going to be just totally full because the demographics are so big. But again, how do you pay for it when you not only got to take the resident in, you got to care for that resident that's really sick?
Yeah. Are they waiting longer because they're healthier for a longer period of time and they're only coming in at that higher acuity, or is there something else that's holding them back, do you think?
I think it's threefold.
Yeah.
I think some are healthier, which is a
Yeah.
good thing.
All right.
COVID are keeping a lot out just because of the memories of how our industry got scars, right? And
Yeah.
some just never want to go. They're just like, we're going to live here until we pass, right? But then circumstances force them in. So it's really, I think our industry needs to change our perception, right? We really need to highlight the fact there's been some studies done that people live longer that go to IL than people that don't, right? Because of the community, of the social aspects of it, right? If you live alone at home, you tend to get sicker and don't live as long. But we don't do a very good job as an industry marketing the positive aspects of that, right? So people still, I think, associate, I'm not going to that institution to die, right? We need a positive message. No, you're coming here to stay independent longer, and for the community and the social aspects of it. And there's a lot of companies that are figuring that out, but I think as an industry, we have to just get louder and better at that.
That's great insight. That makes sense to me. For your personal mission, I know we talked a lot about the platform, but what were the emotional moments that pushed you to build this solution?
Again, I spent years treating seniors. And the first of it was stepfather getting liver cancer, going through our health system, and the coordination of care was a disaster. The whole family being spread out, nobody knowing anything, no doctors talking to each other. This was about 8 years ago. That's what caused me to build Vital Tech in the first place. And then just watching, the just mess of our medical system. But then as we're kind of getting ready to sell Vital Tech and starting to build this, another relative got dementia, and watching that transition, my mother had to care for him, and the emotional toll that had on her, the guilt of, she knew he needed to go into a facility, but it took her almost 2 years to make the decision. And that wrecked her health too, right? I mean, it killed her. And then just when he went in the facility, and again, they were a fairly high-end facility in North Texas, very, very wealthy, high-end market, not an inexpensive place. It still wasn't great, right? I mean, it's just that they're just so many things they lack, right? It's good during the day, but at night they just are understaffed. They don't have eyes on the patient, and we've moved him like 2 or 3 times. Now he's in an awesome place. But the point is that that's not abnormal, and there's just so much that can be done with technology to help deliver better care. There's such an acute shortage of staff, and I don't think it was because the places had bad intent. It's just they didn't have enough staff. They need help, and technology can help. And I think my mission is building the right technology to help the people in this industry that deeply care. And there's so many that deeply care. Man, I follow someone on LinkedIn, Bella and Groves. He owns it. And he is amazing. He has a memory care facility, and he posts every single day. And the way they treat their memory care patients, I wish every facility did that. But again, I think, as he scales, I wonder how he's going to be able to keep that touch, because finding the right level of care to deliver, the right level of people to deliver that high touch care is going to be tough. If he scales and the industry doesn't adopt his model, I'm going to be really mad, because, man, it's amazing. But I think technology is going to be so essential, and it has to be AI, because you have to have something that somewhat acts like a person and thinks a little bit for you and is agentic, that says, here, caregiver, this is what you need at this moment to help you, right? It can't be them going to hunt through spreadsheets or documents to figure out, what did I miss? It's too late at that
Mhm.
point. It's got to be at the point of care. Why? Mr. Smith needs X. Or even before you're at the point of care, go to room 102 because they just got out of bed and they could fall, and you're going to avoid a fall, right? Those are the type of things that are super important. Or, was talking to an ISNF, and they're like, well, we do this risk assessment, but if you could just help us write the individual care plan, you'll give every nurse 20 minutes back. And we're not going to write it and file it. We're going to let them review it. But the point is if we can give every nurse 20 minutes per admit back so that they can now have FaceTime with a patient, that's crazy valuable to them, right? And our system would write that ICP in literally 15 seconds, where it takes the nurse 20 minutes. So that's the kind of stuff that fills me, because I want to give those 20 minutes back to the nurse, be able to sit in front of another resident, another patient. So that's really what my mission is.
And I think that's a really important point that you made too about staffing and, the level of care being on par with the level of staffing sometimes, and that being, for lack of a better word, an excuse that a lot of facilities will use, right? When care is subpar, they'll say, well, we don't have enough staff. Well, that's going to continue to be the case. So the only thing you can scale is technology at this point to help supplement that. And I think this is coming in at the right time. My last question for you, you kind of answered it already, but maybe there's a little bit more to it. How do you design a platform that feels both scalable and human at the same time?
It's got to be conversational. I mean, that's the one thing that the natural language processing and the LLMs have done right. And the only thing we use them for is that conversational ability, right? You got to be able to just talk to it in your tone. It's got to be persona based, so that, again, if it's a CNA that wants to talk to it in Ukrainian, talks to it in Ukrainian, it talks to them right back that way, right? If it's a physician talking to them, it talks to them at their level in their language. It's got to feel like you're talking to a peer in whatever level you're talking to them at, or else they're going to just think they're talking to a machine, right? And whether that's text, like you're texting in a question and it answers back that way, or they're speaking to it, it's got to talk to them in the modality they want to engage as well. Because some people want to talk, some people don't. They just want to quickly text a quick question and get the answer back, right? So it's got to have multimodal engagement in their persona. I think is really, really important, and it can't lie. I think I'd rather hear, I don't have the answer to that. If you want, I can escalate for you, right? Then it makes something up and they find out you lied to them. Because you do that once, a clinician never trusts you again.
Yeah, I think that's the scariest piece of tech right now is like you were saying about hallucinations. So awesome. Well, Ernie, thank you so much for such a great conversation. Where can our audience go to learn more about CareAlly or connect with you?
They could just go to www.careally.ai is our website, or shoot me an email at ernie@careally.ai. Super easy. I'm pretty approachable. I actually read all my email personally still, and happy to answer any questions that anybody wants to send.
Awesome. Awesome. Thank you so much, Ernie. As we wrap up today's episode, I want to thank Ernie Ianace for sharing his journey and for showing us what it looks like to build technology that truly serves the people behind the systems, from AI safeguards and staff relief to platform thinking and value-based care. Ernie's work reminds us that the future of senior living isn't just about automation, it's about orchestration. So if you want to connect with Ernie or learn more about CareAlly, we've included his LinkedIn as well as his email and the CareAlly website in the show notes. As always, we hope you found this episode insightful and inspiring. Don't forget to subscribe to our podcast on your favorite platform and stay tuned for more episodes where we continue to explore the evolving world of senior care, covering everything from care models and leadership strategies to family support, technology, and the future of aging. Also, remember that From Leads to Leases isn't just an audio experience. We're also a video podcast, so you can subscribe to our YouTube or Spotify channels to watch the full episodes. I'm Jerry Vinci, CEO of CCR Growth. Thank you for joining us on From Leads to Leases. Please like, subscribe, and share this episode with anyone who might find it useful. Until next time, lead with strategy and with heart. Chat with you again soon. Thanks, Ernie.
Thanks. Talk to you.
Thanks for listening to From Leads to Leases. Are you ready to fill your rooms faster and increase occupancy? Visit ccrgrowth.com to learn about our Senior Growth Innovation Suite, a proven system to generate highly qualified, tour-ready leads, accelerate sales, and reduce acquisition costs. Let's connect and turn your challenges into opportunities. See you next time.